Hello everyone, I'm Khalid Abdalla. I'm one of the second year internal medicine residents. We're going to be talking about our quality improvement project, improving the quality of the discharge summary template at University Health True Medical Center. My colleagues are Yasser, Sammour, Sidhuja, Palle, Katie Adams, David Roelofsz, Kevin Wang, Andrew Williams, Salman, Mahmood, and Angela Fu. Our project supervisor is our Dr. Julie Banderas and Dr. David Wooldridge. So a bit of background, after a patient's been discharged from the hospital, the main tool that everyone uses to sort of figure out what went on during the admission and what needs to be followed up on in the clinic is the discharge summary. So that one document pretty much sums up their entire hospital stay, and a lot of people rely on that in the clinic to figure out what they need to follow up on. So poor transfer of information between physicians is a known contributing factor to things being missed and adverse patient outcomes. So the Joint Commission has a minimum requirement for what needs to be included in a discharge summary, but they don't necessarily have a standardized template. So the aim of this project was to implement a comprehensive discharge summary template for the internal medicine residents to use, and our aim was to improve the resident satisfaction with a discharge summary template when they follow up patients in the clinic or when we have to readmit patients. So for our methods, we created a new discharge summary template for internal medicine residents to use, and we provided education about the new template. And a pre-intervention survey was used to measure the satisfaction with the discharge summary content, the readability of the discharge summary, and the time it takes to complete it when you're discharging a patient. And our intention is to compare the pre and post intervention survey. So for our results, the pre-intervention survey unfortunately was completed by 10 residents, and it showed that only 20% of the residents who completed the survey were satisfied with the current discharge summary content, and only 10% were satisfied with the time it takes to complete the discharge summary. And really, most of the residents were unsatisfied with the readability of the discharge summary as it is, as it currently stands in its current format. So in summary, we know that the discharge summary is a vital document. A patient can stay in the hospital for 10 or 15 days, and you can have a lot of things go on during that time, and you sort of have to condense it all into one document. So a high quality discharge summary will definitely help anyone who's readmitting the patient or who's following up that patient in the clinic to figure out what's going on. And based on our pre-intervention data, I think there's a lot of room for improvement, at least from a resident standpoint. Once the discharge summary is online, we will monitor the resident satisfaction with the new template. For our limitations, the intervention is currently will be limited to internal medicine residents, and unfortunately only a small number of residents completed the pre-intervention survey. And the big one is there was a lack of time for the intervention to go online, as in the actual discharge summary template to go online and be used on Cerner. So we're currently working with IT to get around that and make sure that it goes online. So hopefully we can get some post-intervention results after the survey after the discharge summary template goes online. Thank you for listening.